Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions,
common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius podcast. My guest today is Julian R. Gershon Jr. He's a triple board certified, so no slouch at all, in family medicine, sports medicine, anti-aging, and regenerative medicine, which is amazing. He also holds a fellowship in stem cell therapy, awarded by the American Academy of Anti-Aging and Regenerative Medicine, and he's a fellow of the American Osteopathic Academy of Sports Medicine, and he's reputed to be 300 years old. I'm just kidding, but it'll be interesting to speak to him today. So welcome, Julian. Thanks for coming.
Great. Thanks for having me.
I hope you don't mind me teasing you about age.
Not at all.
Well, tell me what holds the fascination for you about anti-aging? Why get into it when you have so many other certifications?
Well, my passion's been sports medicine my whole career. I've been fortunate enough to be a Division I team physician at the University of North Texas for 20 years before I moved to Aspen back in 2010. And, I grew up an athlete, ski racing in a snowbank in northern Michigan. And it just seemed to make sense to me as I became an aging athlete that I wanted to do everything possible to feel my best for as long as possible. And I've always had that same approach with athletes, everyday people trying to be their best, perform their best. And I certainly learned that it's just not possible as you age, as hormones decline and as inflammation goes rampant. It increases. So that was really what motivated me to start. I wanted to continue to feel my best, every day. And, that was 22 years ago. I started when I turned 50 doing testosterone therapy. And so I've been, a product of the product, so to speak, for 22 years. And I feel pretty darn good.
Oh, so you did testosterone replacement, I guess. And then what other things have you tried on yourself?
Obviously, I had my stem cells banked in 2012. I had my knees injected. I've done infusions for regenerative purposes. I do peptide therapy, growth hormone, really everything that you could possibly think of to optimize, all the hormones across the board. So everything is based, of course, on science and on protocols and on being in the optimal range for all of our hormones, from free testosterone, total testosterone, DHEA, growth hormone, insulin-like growth factor. We do micronutrient testing, biologic age testing, everything possible to look at all the parameters and make sure everything's being addressed properly.
What kinds of things have you tried that you felt worked well, and which ones are you like, I don't know, but at least on paper it looks good?
Well, I think the key is hormone balancing for me, for men, testosterone. For women, it's estradiol, progesterone, testosterone, DHEA, thyroid, and looking at all of those things. I've used different peptides for enhancement of sexual function to improving your growth hormone levels naturally, more physiologically, I guess I'd say. I take a lot of vitamins on a regular basis because unfortunately, the micronutrients are just not in the foods we eat, whether they're organic or not. They're often grown in nutrient poor soils, and it's very difficult to measure that. And so we just know it exists. And so I'm constantly trying new supplements, taking things that really just help to improve our performance and the way we feel on a daily basis.
Okay. So what are some of the very typical protocols that you'll do in your clinic when someone comes in? Like, what are some of the most common problems people have, and what do you do to help?
The most common thing would be that they, just feel like they're slowing down. They've lost a step. I'm not as motivated. I'm not having fun with my spouse. I don't want to deal with the kids or grandkids at 4 or 5 in the afternoon. I just want to relax or go to the couch or whatever. And or sexual function. Sexual function is a big one. Men can put up with a lot of changes in lifestyle until that goes south. And then, it's like, hey, maybe I need testosterone. So we do comprehensive blood tests and look at all the hormone levels and then design a plan to restore them to youthful levels, which, it's really interesting and unfortunate as well that most physicians are just not aware of what optimal ranges are, that we should be where we were in our 20s and stay that way for a lifetime. And so, we're always, I call it the foundation as, baking the cake. And that would be testosterone therapy, DHEA, addressing growth hormone levels, whether with peptides or actual growth hormone. And then icing the cake there's a lot from doing biologic age testing. I do senolytic drug therapy using rapamycin, quercetin, and dasatinib, things that help to rid the burden of inactive, dormant cells that are just kind of hanging around and a burden on the system. We know from longevity studies that in animal models that they lived longer, and so that then extrapolates to what we can do for ourselves. So there really is just a growing amount of data and of good ideas of things that work to help with that, from, again, vitamin therapy, antioxidants, glutathione, NAD, nitric oxide. I mean, it's just, it's almost impossible to dig into everything in the first hour that I see a client. And so when we get started, schedule follow-up, make sure that the basics are covered and that those levels are starting to improve. And then we just kind of add to things as we go, so to speak.
For instance, testosterone, you're using, inserted, I forget what they call them, the seeds or pellets, or do you do creams, or are you doing injections? Like, whatever you see clinically that works.
I do a combination. They all work. Creams are my least favorite because of once you put it on the skin, it converts to DHT, dihydrotestosterone, which can have some negative effects on prostate and on hair growth, but a lot of people like creams because they are very simple to use. I have a number of men on self-injection where I have them use testosterone, let's say on a Monday, and then HCG, human chorionic gonadotropin, on a Friday to help keep the levels a little more stable and to help prevent testicular shrinkage, let's say. And in younger men, that's all I use would be HCG and clomiphene or N-clomiphene. And then, so it's personal preference. Some guys would rather just give themselves an injection. It isn't a big deal. I have just as many that are like, no way am I giving myself a shot. Like, okay, fine. We can use cream or I can insert a pellet. And I've started using technique from a company called Avexius, where we put them in the love handles. We used to put them like in the gluteal muscle above between the glutes over the hip pocket. And they work great, but they tend to be a little more uncomfortable for about a week while things settle down. And every time we're moving, walking, hiking, especially in a place like Aspen, the more movement there, the more it can remain tender for a little while. And so I found in the last 6 months since I've switched to using this technique where we come around from the back into the love handle, that they feel great. I ran into a friend of mine at an event here in Aspen last night, a cancer benefit for kids that I just did it yesterday morning or the day before. And he's like, this is unbelievable. I'm not sore at all, and I did this. I said, well, slow down, I still want you to take it easy for a few days, but he loved that new placement technique. And so I like pellet therapy a lot because it's the most consistent dosing format that we have. It's based on, you absorb them based on your cardiac output, your activity levels. And so they, within 2 to 4 or 6 weeks after placing the pellets, they reach their peak and they stay there for 5.5 months, usually are certainly ready for another round by 6 months. So for men, it's twice a year. For women, we do that about every 4 months. And so it's one of my favorite techniques.
Any other problems with the injections besides people being afraid to do it or not wanting to do it?
Not really. I know that in some other providers maybe give up someone an injection once or twice a month, and that just produces too much of a big peak and trough. And so we do it weekly. I have a few guys that will split the dose and do like Monday, Thursdays. So it's just more uniform delivery, and it's very easy to do and relatively inexpensive. And, some that just want to do the pellets, and once they've done them, I think they tend to really prefer the pellets because you don't even have to think about it. You don't have to remember doing my shot today or not. It's like, okay, I'll see you at my next appointment for blood work and we'll go from there.
Okay. So what's another very common protocol that you do for people? Your PRP or, in the world of stem cells?
Well, I do a lot. We use stem cell harvesting where we'll do about a 30-minute procedure in the office of a minimally invasive liposuction, which sounds like a big deal, but we really only need to harvest an ounce or two of fat in order to have enough to process for treatment at that time and to send to a banking facility where it can safely be prepared and saved, for future use. The thing I like about that is they're your cells, although I've never had any problems with any of the other products that I used back when I was doing umbilical cord blood stem cells or umbilical cord based cells to exosomes. I've still never seen a problem. They're very, well screened for infectious disease. And as they say, they're immune privileged. In other words, they're so young, they haven't differentiated, so they really don't create a graft host response. I actually never had a problem using any of the other products, and I've done well north of 1,000 injections, into the thousands now. But there's still something to be said for banking your own. And, the future will tell as we develop new methods and new techniques and new abstracts. I'm sure someone always has a better idea. But, from joint therapy, I just did a guy's hip today. 6 weeks ago, I injected his hip with a regenerative product. And today I like to do a PRP follow-up injection. And I just call it the fertilizer shot. People understand. I say, we're going to fertilize the lawn in about 6 weeks. We want to come back in where we put those stem cells and maintain a good environment, decrease inflammation further, and help stimulate more cartilage growth. And so he had a hip that he had significant pain for 3 or 4 years. When I did it 6 weeks ago, it was a 7 out of 10 and occasionally worse. Today he said, I don't have pain most of the time, and it's occasionally a 2, and that's only been 6 weeks. So, it's really exciting. From my sports medicine days, what could we do? We gave a cortisone shot or an anti-inflammatory medicine that may cause ulcers and stomach problems and who knows what else, and or send them for surgery. And the surgeons are limited. If they weren't ready for a joint replacement or didn't have a big cartilage tear to sew back down, there really wasn't much else that could be done. And so that's been the exciting thing for me in being able to really help people to impact their daily lives just from doing what to me is a very simple interaction.
Okay. Any up and coming procedures that are like really new, maybe they haven't hit the clinic yet, or they're about to, that would really be, game changers or solve problems that are unsolvable right now?
Well, it all depends on, really what Bobby Kennedy can do with the FDA and the regulatory agencies, because what we do is the future of medicine. And thank God the state of Florida legalized everything about stem cells, stem cell therapy, exosomes. And because, with Big Pharma's grip on the FDA, they've been very much against everything we're doing because they didn't have they didn't own it. And so to even mention systemic disease, emphysema, rheumatoid arthritis, autoimmune conditions, I've seen a lot of benefit. And unfortunately, we've had to kind of keep the lid on things and not discuss it and not even approach it like we'd like. There's tens of thousands of patients that would love to help that suffer greatly on a daily basis. And so fortunately for the state of Florida, I think that other states will start to fall in line with what they're doing. And it really should just be a national thing. It shouldn't have had to go to that point. But fortunately, there were a lot of forward thinkers that lobbied and worked hard to get the legislatures there to see that this is a good thing and this is safe. And a trained physician with, a fellowship, a background in this, and a certification should be able to make those decisions to the best of their ability for their patients and not have some government agency say, well, you can't do this because, our farm buddies over here don't like that.
Yeah, I'm sure. Well, sure. So, what are you excited about that's new, Sully?
I've been doing this all for quite some time. And I think the testing that we can do to localize and find specific solutions to problems is a big deal. The DNA methylation testing and telomere length testing that can very specifically tell us where a person is at. The future of genetic testing, of CRISPR therapy. I mean, it's just, there's a lot of bright minds out there expanding this longevity space. I don't think we're going to create immortality. That's not my goal. It's to live as long as possible to the best of our ability and be vibrant and interactive with our families. I was blessed to have my father just passed last week. He was almost 1, and my goal's 120. And so as long as I'm as vibrant as he was, he didn't go down till 1 week before he passed, and which was great. And I got to be, at his bedside with him just prior to that, and to have peace with each other and where he was going. And, it was actually a beautiful thing. Very sad, but
sad it happened. Yeah, my dad passed earlier this year, but he was probably the opposite of yours. He didn't listen. He wouldn't do anything besides like the most traditional stuff. And he was suffered for probably 3 years before he passed. So it sounds like your dad went the optimal way. He was great until like the last second, and then that's it.
Well, and there are so many people that we can help. As I said, because of what's going on in Florida, we need to be able to use stem cells and exosomes systemically. They target areas of inflammation, they modulate the immune system. They've been an amazing treatment for COVID long haulers, for vaccine injuries, which they promised us wouldn't happen. But my brother and I both suffered from that. Actually, therapy has been just day and night difference in the amount of relief that it gives. And to be
what is the exosome therapy? What does it do?
It modulates the immune system and decreases inflammation, targets areas of inflammation. So it has a very profound systemic effect and should be able to be used and investigated in studies, for everything. I mean, I really believe it's the future of medicine, and I think it's unfortunate that it is where it is right now, but it's evolving rapidly, and, it's an idea whose time is more than come.
Anyone that's using exosome therapy with cancer? Because, from my interviews, I've seen that, especially metastatic cancers, they'll send out their own exosome or extracellular vesicle profile. So I would think that, people would be there if you were the communication of sites, or who knows.
I avoid that topic because right now that would be the kiss of death for me. I have to stay away from that. fascinating, and I do think that there are centers that are doing studies, and it may be a matter of time. I can't tell you yes or no, but I think that it only makes sense that targeted therapy definitely has a place in the future.
Because last, are there any conditions that when you tell people, yes, there's a possible way we could help, this protocol, are they surprised? Wow, I didn't know anything could be done for this.
I think it's so that people are, surprised with a lot. None one knows that they don't have to suffer, that they don't have to have a joint replacement yet. If there's a technique to actually regrow cartilage and reduce pain, like the guy I told you about earlier, and why wouldn't you do that? I had a hip replacement because of the COVID vaccine. It started 2 weeks through my second Moderna injection, which I don't mind telling. And it was severe, and we did everything we could for that. And although the surgery went well, and it was, as far as I've had knee reconstruction from ski race. I had a lot of things that were quite painful. That was easy as far as surgical procedures go. But it would be great to put that off. 5 years, 10 years, or definitely. I have that I've done 5 to 10 years ago who come back and say, I'm just starting to have a little pain. It's a 2. Can we do that again? I'm like, yeah, why not? And I will articulate both of her knees 9 years ago. 2 years ago, we re-injected them. She was told then to have bilateral knee replacement. And she's like, I can't do that. I have to ride horses for a living. I do old books and that. And I'm like, well, then let's give it a shot. We used her own adipose-derived stem cells, and she's done great ever since.
Okay, well, that's fantastic. I'm sure it's also helpful, too. You can tell your patients, your choice. You disclose, well, I've had this problem, I've had that. And it's like the old hair club for men. You're also a patient or a client, not just the seller of it.
Well, and speaking of hair growth, you can look on my website, and the before and after pictures on that page on hair growth were my scalp after one endostome injection. I've actually done it a couple times. I'm overdue by a year to do it again, but it's kind of nice to hang on to it, as opposed.
Yeah, that's great. Okay. What areas do you serve? The podcast, people listen all over the world, all over the U.S. Where can you help people and where can't you?
Well, I guess living in Aspen, it's somewhat of an international destination, so I end up having patients all over the world. I do telemedicine with people literally all over the world. The requirement is I have to see you once in person for it to be legal to prescribe testosterone, which is still a controlled substance. It should be changed. It's a hormone, and no other hormone is a controlled substance except testosterone. So I think that will change down the line. But because of the podcast and my book release, I have a lot of people reaching out to us who come in to see me here, either in Aspen or our Denver office, get things started. And then, I can send them to a LabCorp anywhere in America. I have a couple of people overseas in Italy and Spain, Mexico. A little harder to get the blood work, but not impossible. And then we do telemedicine.
Okay. Well, very good. And the best way to contact you is just to go to the website, or where can people go?
They can go to aspen-regenerativemedicine.com. We're on Instagram and Facebook as the Aspen Institute for Anti-Aging and Regenerative Medicine. On Instagram, it's just Dr. Julian Gershon. There's links to our email and phone, and so certainly feel free to reach out. I appreciate the opportunity to share with you today.
Yeah. Thank you, Julian. Appreciate you being here.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.